Dr. David Ajibade is a public health physician, also CEO of Brain and Body Foundation. He joins us from Virginia in the US. Thank you for joining us on the program.
Thanks for having me.
Sadly, the US has passed the figure 500,000 COVID-related deaths, the highest number of any country, such a global record of the outbreak. How are health workers over there reacting?
Well, Muslim is really hard. I have many friends who are ICU workers and critical care doctors, and they say they've been overwhelmed. More so about 2-3 weeks ago, but now it seems to be on the decline, at least according to the statistics. But in the critical care areas, it's still a bit of a problem. So it's a challenge.
The president of the US has ordered all flags on federal property to be lowered to half-mast for the next 5 days. But more importantly, how fast are the COVID-19 vaccinations going to stop the spread?
Yeah, that's a good question. Right now, there are about 20 million who have been fully vaccinated. That means they've had both doses. Now, in many parts of the country, maybe you've heard about it, but 2 weeks ago, there was a severe ice storm, snowstorm, and many parts of Texas and Oklahoma were really, really badly affected. And so that has affected the distribution of the vaccines like they should. So that has slowed things down. I mean, the country has about 330 million people. So far, 20 million is not nearly as fast as it should be, but they're trying their best to get it done out there as quickly as possible. Obviously, they are focusing on the people who they see need them the most, the older patients, the healthcare workers. Priority is given to those who are in the military. So people who are older and in the military tend to have them and their spouses taken care of. But it's still a challenge.
Well, President Biden has also talked about reaching his milestone of 100 million in 100 days in office. Do you think that he will achieve that?
These recent events have certainly slowed things down. How far have we gone into it now? So just over a month now. It's possible. I mean, they do have great infrastructure here, so they can, if they really put their minds to it, they can get it done. Of course, you have to face the fact that a lot of people are what is known as anti-vaxxers, who still are having a challenge accepting the vaccine, some because of some issues they have seen here and there. But for the most part, the vaccines seem to have been very safe. I've spoken to quite a few people who have had a vaccine, and other than some soreness on the parts where the vaccine was given, and maybe a little slight fever, many of them have done very well with the vaccine.
I want to ask you about some anti-vaxxers who are Nigerians, as we are expecting our own vaccine. But to the politics side of things, how true would you say this administration's approach to the pandemic is compared to his predecessor, Donald Trump? Quite a lot of heavy politicization of the wearing of the face mask and other measures needed to prevent the spread. I mean, when you look at this grim milestone.
Yes, you're right about that. It being a very, very politicized an issue. With the previous presidents, obviously there wasn't that much focus on masks. Obviously, there wasn't that much focus on reducing the spread. And part of it, and I'm going to get to the current president's approach, which I feel is very scientific, and they are really aggressively going for it. But part of the issue is that you also have to look at it from both sides, which I think the past president was looking at, the financial aspects, the toll on the mental health of children as well as adults. They were looking at that, and that can, in the long run, be much more have a greater impact on people. So they were looking at trying to get people moving and quarantining those who were obviously more vulnerable to it. Now, on this side with the President Biden, it's a global attack. The vaccines, they're very, very strong about the vaccines, very, very strong about using masks. And in fact, many centers and businesses will not allow you to come in if you don't have your mask on. And now they're focusing more on the actual surgical masks, even in the airports now. If you're just having a bandana, which is like a scarf, across your face, they're not going to let you on the plane. You have to have a surgical mask, and that's spreading. And I think you need to take a more serious approach to it. But like I said, in the United States is the economic center of the world. If you can't, there's some things you can't do there the way you would do in other countries. And so there's that delicate balance to attain to. You have to look at the mental health, you have to look at the economic health of the people, as well as on the vaccines, as well as really the physical health. And yes, the vaccines do a lot of work. President Trump had really pushed for the vaccine to be produced in record time. So credit goes to him for really pushing that. But again, that vaccine has to get to the people.
Just, in a few seconds, for the anti-vaxxers, Nigerians, what do you say to them? I
say, do your homework, look at it carefully, weigh the pros and the cons. So far in this country, a lot of people have had really good results with it. So weigh the pros and cons. There's a lot of risk involved in having COVID-19. So long-term risks as well. So please.
We appreciate your time.
Look at this.
Thank you so much, Dr. David Ejibade, a public health physician, CEO, Brain and Body Foundation. Thank you for joining us on the program.
Thanks for having me.